In this last year, India has really faced lots of problem as far as the cancer incidence is concerned. Every year we are reporting a very high incidence and the changing paradigm, like, in certain area cancer rates are very high, incidence is very high, and every year we are reporting, the increase in number of cancer patients. We all know about the conventional cause for the cancer, but in last few years where WHO has reported 14 out of 15 cities in the world belong to India. Environmental and factors has, come up very, as an important factor as far as the causation of cancer is concerned. So it's an important to know about environment. Delhi is one of the polluted city which has been marked, and we have seen there is an increase in the number of cancer patients which is going to the hospital in last few years. So it's very important to know about what are the environmental factors, how they are affecting the normal life to the common people, and how it is causing the cancer. Occupation is related to the environment in which occupation you are working. They are, how safe it is and how it is just contributing to the environmental factors which is finally causing the disease. We have done one conference in last May 2018. We discussed about the various environmental and the occupational determinants which is causing the cancer, and we found that there are many factors related to various industries which is causing cancer. The most common cancer which is attributed to the environmental factors and the occupational factors is lung cancer. Lung cancer has become an important issue in India for last many years. Now it's the number 2 cancer as far as the total incidence is concerned. In male, if you consider the one subside, it is the most common cancer in male. In spite of the fact that smoking is contributing to the maximum, but yes, now the environmental factors largely contributed by the air pollution has come up as an important risk factor for lung cancer. We all know, as far as the WHO estimates, 10 million people are dying every year due to air pollution, and in its major contribution is from the developing world. So India being a developing country, the contribution to this number is much high, but yes, there is a paucity of information, there is scarcity of data, so we need to conduct more studies to understand the correlation between the various environmental and occupational determinants and how it is causing the cancer. In India, cancer is one of the major factors which is causing the death of the common people, and now cancer was not a common disease 10 years back. With the increased awareness and the increased total number of registry of the cancer patient, now we can estimate the number is increasing. What we all know that in India, the after working for the patient and after working for the community, we have come to know that there is a very less knowledge about the common risk factors, about the symptomatology, about the treatment, about the common people. So what is important, how we are dealing our problem in India, we are just focusing on our individual oriented approach, which is if I get sick, I just go to the hospital, take the treatment. If my family member is having problem, I just get along with my family member, get the treatment. But yes, what is missing? We are just missing the socio-cultural determinants which is actually causing the disease. So to combat this factor and to deal with those factors, we need to have a community-based cancer prevention, and we need to educate people about the cancer. But problems are many. India is a 1.38 billion people are living here, so it is a difficult situation how to reach people and what will be the effective communication by which we can reach to common people of the India. Government has various programs started long back, but ultimate problem is the enforcement and how we can approach the people on the ground. So community based cancer prevention is generating lots of hope, because this is the only way you can reach people, you can educate people, because if you talk about the treatment and out of pocket expenditure, it is really difficult to reach everyone and get the treatment in the hospitals where we have the long queue. There is a problem, at the part of the patient, because everybody thinks that cancer still is an incurable disease. Initially we used to think that why people are thinking like this, but this is a very good theory. Like, most of the people who comes to the hospital comes at the advanced stages of the cancer. So when they have the advanced stages, we know cancer survival is largely dependent on the time at presentation. So mostly they die, and suppose in the society, if you see 5 people suffering from the cancer, they are all advanced stages, and all of them die within 1 year of time. It is very general that everybody will understand cancer is an incurable disease. So if you want to change the mindset of the people, you need to work at the community level. We need to educate them, and cancer education is the most promising way to make people aware about the cancer sign and symptoms, about the symptomatology, about the risk factor, so that they can know, and when they have any problem, they can reach to the hospital. Otherwise, we are just focusing on the treatment part, diagnosis part. Everybody, is talking about immunotherapy, but yes, we are still lacking about the basic information about cancer when we talk about the common people in India. So we have lots of hope. India is a very diverse country. When we talk about Indian diversity, we feel very happy that as every 50 kilometers we have a change in our languages, we have our change in our culture. But when you come to deal with these factors, when cancer education is concerned, we find it very difficult. So apart from being very diverse, we don't need to wait other things to happen and cancer treatment reaching to every people in India. We need to work simultaneously on the cancer education, cancer screening, and for that we need to educate community level people, so that they can come forward and get their screening done. They can help their other family members to deal with this disease more efficiently.